Organ relationships between lung and spleen, lung and liver. Key points, the physiological relationships, generation of qi. The lung controls breathing and governs qi, while spleen governs transformation and transportation of food essence. Fluid metabolism. The lung regulates the water passage, while the spleen governs the transportation and transformation of the fluids. The relationships between lung and spleen are mainly reflected on the coordination between generation of qi and water metabolism. Physiologically, the lung controls breathing and governs qi. Spleen is the source of nutrients for growth and development of qi and blood. The generation of qi, especially the pectoral qi, depends upon the combination of the fresh air inhaled by the lung and the food essence transformed and transported by the spleen. As for the fluid metabolism, the lung regulates water passage and belongs to the upper source of water, while the spleen transforms and transports water to guarantee generation and distribution of water. The lung distributes water to all parts of the body, and the spleen absorbs and transports water as well as permeates water upward to the lung. This harmonious balance between the lung and the spleen is needed for a smooth fluid metabolism. Deficiency of spleen and lung qi will lead to shortness of breath, no desire to speak, poor appetite, and loose stool. If it affects the metabolism of fluid, it may lead to edema, cough, asthma, and profuse phlegm. The lung and the liver. Key points: physiological relationships, regulation of qi movement. The liver governs the ascending of qi, while the lung governs the descending of qi. The relationships between the lung and the liver are signified by the interdependence and coordination of the qi movement. Physiologically, the lung governs purification and descent, while the liver governs ascent and dispersion. The coordination between the ascent of liver qi and the descent of lung qi plays an important regulatory role in the whole body's qi dynamic. Pathologically, too much fire in the liver or overly descent of liver qi will consume lung yin, which leads to the symptoms of cough, chest pain, and hemoptysis. Thank you very much for your attention.
Now let's go to interviewing. The topic is blurred vision and floaters. There are three Chinese terms that may be translated as blurred vision. The first is mu xuan, mu meaning eye, in which the term xuan suggests also dizziness. The second is mu hun, in which the term hun suggests faint feeling. And the third is mu hua, in which the term hua means flower. And the two terms together indicate that the patient sees objects that look like flowers or butterfly wings. That is, floaters. This third term thus could be translated more specifically as seeing floaters. The Chinese term for blurred vision therefore also implies the symptoms of dizziness, and there is a certain overlap between these two terms and symptoms. In fact, the term for dizziness is xuan yun, xuan being the same character as in mu xuan, meaning blurred vision. For liver blood deficiency, where there's blurred vision and floaters, there will also be dizziness, numbness, or tingling of the limbs, scanty menstruation, dull pale complexion, and pale tongue, choppy or fine pulse. The acupuncture points for this is liver 8, stomach 36, spleen 6, Ren 4, and Li 4. When there's liver yin deficiency, the blurred vision and or floaters will be accompanied with dry eyes, diminished night vision, dizziness, dry hair, numbness or tingling of the limbs, insomnia, scanty menstruation or amenorrhea, dull pale complexion without luster but with red cheekbones, cramps, withered and brittle nails, night sweating, normal colored tongue without coating, and the pulse will be fine or floating empty. The acupuncture points are liver 8, stomach 36, spleen 6, Ren 4, kidney 6, and Li 4. When blurred vision and or floaters is caused by kidney insufficiency, there will also be dry eyes, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth and throat at night, lower backache, constipation, dark scanty urine, tiredness, and the tongue color will be normal but without coating, and the pulse will be floating empty. The acupuncture points is kidney 3, Ren 4, bladder 23, spleen 6, Ren 12. For turbid phlegm in the head, blurred vision and or floaters will also have dull headache with a feeling of heaviness and muzziness of the head, poor memory and concentration, dizziness, sputum in the throat, a feeling of oppression of the chest, nausea, and the tongue will be swollen with sticky coating, and the pulse will be slippery. The acupuncture points for this is stomach 40, REN 12, REN 9, REN 5, bladder 22, and LI 4. For blurred vision and or floaters often occurring during a headache attack is liver yang rising. There will be headache, dizziness, tinnitus, irritability, propensity to outbursts of angers, and the pulse is wiry. For heart blood deficiency, there will be palpitations, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, dull, pale complexion, pale lips, the tongue will be pale and thin, and the pulse choppy or fine. When there is liver fire, there will be blurred vision, bloodshot eyes, painful eyes, headache, red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine, red tongue with redder sides, and dry yellow coating, and the pulse is wiry and rapid. When there's heat in the gallbladder, there will be blurred vision, dizziness, tinnitus, bitter taste, dry throat, irritability, red face and ears, hypochondrial fullness, unilateral or bilateral yellow tongue coating, and a wiry rapid pulse. For deficiency of Minister fire, also kidney yang deficiency, the blurred vision and or floaters will be accompanied with watery eyes, lower back ache, cold knees, sensation of cold in the lower back, feeling cold, weak legs, bright white complexion, weak knees, tiredness, lassitude, abundant clear urination, scanty clear urination, urination at night, infertility in women, impotence, premature ejaculation, decreased libido, and the tongue will be pale and wet and the pulse deep and weak. For spleen chi deficiency, the blurred vision or floaters will be accompanied with tired eyes, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, and the tongue will be pale and the pulse empty. Thank you so much for your attention.
Let's proceed to the part five of our supporting treatment using Yangshen with resistance to giving things up. It is typical for most clients to ask, what can I eat or what can I take that will be good for me? Unfortunately, a lot of the dietary advice we give, usually we tell them what they should avoid in their diet, as well as recommending exercise, rest, meditation, and so on. As we list the food that they should avoid, they often exclaim, but there must be something that will be good for me to eat, something that is beneficial. Here we can see a fundamental problem with the Western consumer mentality. We have developed an expectation that we can purchase or consume a solution. Every time we are dissatisfied or when life does not live up to our expectations, we believe that there must be something we can buy or at least assume that there will be something that will be salutary for us to consume, some sort of magical pill or superfood. In general, we have more difficulty with the more Eastern esoteric approach that is happiness. In this context, healing, which is a process of letting go of things. Eastern philosophies have often focused on abandoning the bonds of materialism, letting go of bad habits, and ultimately letting go of the ego. Usually, the healing process of the physical body is also about avoiding certain foods and letting go of bad habits. This is because it is these things that have given rise to the problematical condition. Simply consuming something new, something additional, does not remove the cause of the problem. In fact, it increases the risk of creating a new problem. For example, if a person has a fire condition, it will be beneficial for them not to consume things like chili, alcohol, pepper, garlic, lamb, cinnamon, chips, crisps, fried food, and so on. If they do not drop these things and instead just consume foods that are extremely cold in their energy to counteract the fire condition, they will risk injuring their spleen chi without necessarily creating an improvement in their symptoms. because they're still ingesting things that aggravate the fire condition. This is similar to people who believe that by eating some organic carrots, they can continue to eat chips, cakes, cream puddings, and chocolate and drink copious amounts of red wine. The organic carrots may well be packed with vitamins and minerals, but they do not counterbalance the other things being consumed. Salutary food should be instead of, not at the same time as, at least if you want to create long-term harmony in the body. Another thing we often hear when we start telling people which things they ought to exclude from their diet is that they exclaim, "But that's everything that I eat." Although in reality, they probably do not eat other things. There is a reason. In reality, they probably do eat other things. There is a reason that they have developed certain patterns of imbalance. And this is often due to the excessive consumption of an inappropriate diet that is very one-sided. Central to all Chinese medicine diet therapy is maintaining the health of the spleen and the stomach. No matter what imbalances there are, account should always be taken of what effects the suggested changes in the diet will have on the spleen and the stomach. This is because the stomach receives all the food that is ingested through the mouth, and the spleen yang qi that must transform the food into good qi and extract the essence out of it. This means that regardless of what other qualities the food has, and no matter what organs and channels this food affects, it will always also have an influence and an effect on the stomach and the spleen. This therefore means that diet therapy is sometimes a bit of a balancing act in which you try to achieve a therapeutic effect whilst trying not to injure the spleen and the stomach. This relates back to some of the very first classes we had in our acupuncture training. In these classes, we learned about the production of qi. We learned how the stomach can be envisioned as a cauldron that is filled with food and liquids that you ingest. The spleen qi is the flames below the cauldron that transform the ingested food and liquids in a soup from which rises an aromatic and nourishing vapor. More precisely, we learned that the stomach receives the food and liquids ingested through the mouth, and it ripens and rots this in preparing them so that the spleen can transform the ingested food and liquids into good qi and extract the essences from it. Furthermore, because of their location in the center of the body and the dynamic of sending qi upwards and downwards, the stomach and spleen will affect the movement and the communication of qi in the whole body. It is therefore paramount that we support the spleen and the stomach as much as possible through the diet. This can be done by following a few basic rules of eating in Chinese medicine. Most of the recommendations actually also make good sense from a Western medicine physiological perspective. Thank you for your attention.
Diagnosis according to Sanjiao theory. We discuss lung heat. This pattern is the same as the one discussed in Qi level heat in the 4-level diagnostic model. Etiology, exposure to pathogenic heat. Symptoms and signs, fever or feeling of heat without aversion to cold. Cough with yellow sticky sputum that is difficult to expectorate. Profuse sweating, thirst, chest pain, dyspnea, red face, restlessness, restless sleep, red tongue with yellow coating, rapid pulse. Key symptoms are fever, cough with sticky sputum, thirst, rapid pulse. Treatment principle, drain heat from the lung, regulate lung qi. Acupuncture points to choose from: lung 1, lung 5, lung 10, lung 11, LI4, DO14, and bladder 13. Needle technique is draining. DO14 can be bled. Lung 1, lung 5, and bladder 13 drain heat from the lung and regulate lung qi. Lung 10 and lung 11 drain heat from the lung. DO14 and LI11 drain excess heat. The person should avoid consuming food and beverages that will create additional heat in the body and avoid the inhalation of tobacco smoke. Lung heat can be caused by wind heat. Lung heat can result in middle jaw heat, lower jaw heat, phlegm heat in the lung, and lung yin deficiency. Thank you very much for listening.
Let's go to Zhang Viscera. Topic is heart relationships. Relationship of heart to other organs and tissues. Number one is governance of blood vessels manifests in face. As mentioned above, the heart controls the flow in the blood vessels, which are the pathways for the movement of qi and blood, so that both move in an orderly fashion and following designated routes in order to deliver nutrients to the entire body. Only when heart qi is strong can the normality of the physiological functions of heart blood be maintained. CM believes that the fullness or deficiency of the essential qi of the viscera can be revealed in the organs in the exterior of the body. This is known as the outward appearance of quintessence, the five Zhang organs, each having its manifestation. Manifestation in the face means that changes in the color and luster of the complexion reflect the fullness or deficiency of qi and blood. If heart qi and heart blood are abundant, the complexion will be lustrous and moistened. Conversely, if heart qi and heart blood are deficient, the complexion will be pallid, lusterless. If heart blood is static, then the complexion will be cyanotic. If there is heat in the blood, the complexion will be red. If heart blood has collapsed, the complexion will be pallid and withered. And number two, opening orifice and tongue. This is known as the tongue is a sprout of the heart. The tongue is like a mirror that can reflect the heart's condition and functional state. A collateral meridian of the heart meridian of Han Shao Yin extends into to the root of the tongue. The heart's qi and blood pass through the meridians and reaches the tongue, thereby maintaining the tongue's normality and functions. The tongue has two main functions: taste and assisting in the production of speech. Both functions depend upon the heart's functions of governing blood vessels and governing the mind. For example, if the heart's qi and blood are abundant, the tongue will be supple and agile, speech clear and fluent, and taste keen. If qi and blood are insufficient, the tongue will be pale and taste blunted. If the heart fire flames up, the tip of the tongue will be bright red and the tongue may have ulcers or sores. If the heart blood is static, the tongue will be dusky or covered with sores. If heat invades the pericardium or phlegm obstructs the orifices of the heart, the tongue will be stiff and speech stammering. The pericardium is a membranous envelope of the heart. Its main physiological function is to protect the heart from injury and to promote the circulation of qi and blood. In the CM theory of visceral manifestation, the heart is the master Zhang organ and therefore must not be invaded by evil qi. Because the pericardium is a shield for the heart, CM believes that when evil qi invades the heart, it must first attack the pericardium. Hence, severe warm diseases manifested such mental symptoms as high fever, fainting, delirium, which are induced by the heat evil, are ascribed to heat entering the pericardium. Similarly, such symptoms as loss of consciousness and impeded tongue, which are induced by phlegm heat, are ascribed to phlegm obscuring the heart orifices. It is thus clear that the symptoms of disorder of the pericardium are actually manifestations of disturbances of the spirit. They can therefore be cured by methods of treating the heart. Hence, the pericardium is not an independent organ, but is really an appendage to the heart. Thank you so much for your attention.
Let's now talk about diagnosis according to Zhang organ patterns, heart imbalances. The heart is an interesting organ. In Western medicine, the heart and the brain are the two most important organs in the body. A person is declared dead when these organs are no longer functioning. The Western medicine heart and brain can be considered to be aspects of the same organ in Chinese medicine, even though the brain is one of the 6 extraordinary organs and is created from kidney jing. It is nourished by heart blood, and much of its functionality in Western medicine relates to the shen, which has its residence in the heart. This makes the heart the most important organ in the body in Chinese medicine. The heart is described as being the emperor of the body. The heart is a true emperor. It does not do much in the physical day-to-day functioning of the empire, but its balance and health are crucial for the functioning of the whole realm. If you look at the functions it performs, The heart does very little compared with, for example, the spleen. Yet it is the body's most important organ. Just like an emperor, Shen is conscious of everything that is going on in the whole realm. Every detail is reported back to it. Events occur in the various organs and body parts, but it is Shen that makes us aware that this have happened. For example, when we burn a finger, it is the tissue and skin of the fingers that are burnt, but it is our brain that perceives and interprets the signal that it receives from the nerve receptors in the fingers. In the same way, it is our Shen that makes us conscious of the sensations of our body experiences. This also happens on the emotional level. All emotional influences will have an impact not only on the organs that these emotions resonate with, but also on the heart. The emperor has responsibility for the whole empire. Therefore, he must be omniscient so that he knows what needs to be done in all situations and at all times. It is his responsibility that the empire is harmonious and functioning perfectly. Without his guiding hand, there will be chaos and rebellion in the empire. The whole empire would disintegrate. If the emperor becomes weak or insane, he will not be able to rule his kingdom. The same is true of the heart. If the heart loses its stability, havoc will start to arise in the body. Therefore, there are many protective agencies around the heart, including the pericardium. It is important that an invasion does not penetrate into the emperor's residence. Now let's take a look at the etiology of heart imbalances. Due to its responsibility and importance, the heart needs to be protected from attacks of exogenous pathogenic qi. Heat that can be caused by invasions of exogenous pathogenic qi can penetrate as deep as the pericardium, which protects the heart, but does not enter the heart itself. This does not mean that the heart cannot be disturbed by pathogenic qi, but that the pathogenic qi that disrupts the heart will be internally generated. The heart, for example, especially sensitive to all forms of internally generated heat, both deficient and excess. Due to its yang nature, heat tends to rise upwards in the body and therefore it will often end up affecting the heart, which is located in the upper jaw. Invasions of exogenous cold will not directly invade the heart, but they can create a stagnation of heart blood, which can affect the functioning of the heart. The heart is particularly affected by feelings and emotions. Although the individual emotions affect specific organs, it is the Shen that makes us conscious of these feelings and the effects that they have. Anger, for example, affects the liver, but it is our Shen that makes us aware that we are angry. When we are angry, the anger causes our liver qi to ascend upwards and it can generate heat in the liver. When we are very angry, we are conscious of these changes. For example, the tension in the shoulders, neck, and head due to the qi rushing upwards. We're also conscious of our emotional state. We are aware that we are angry. If anger affects only the liver and not the heart, these changes would take place without us being conscious of them. This means that any prolonged or extreme emotional influences will also have an impact on heart qi and shen. The heart itself is directly influenced by joy, and joy can be an etiological factor that can be involved in the creation of heart imbalances. It can seem strange that joy could be something that creates an imbalance in a person. Nevertheless, joy or the lack of it is a major etiological factor in heart imbalances. First, joy has a nourishing effect on the heart and shen. A lack of joy in a person's life will lead to the creation of a deficient condition of the heart due to it being malnourished. This is also why several of other emotions that are ascribed to the organs directly affect the heart qi. Melancholy, sorrow, worry, fear, and anger can all encompass an aspect of not being happy, of not being content. Second, there can be also too much joy. This does sound paradoxical, but joy does not only nourish the heart, it also stimulates it. too much stimulation of the heart will dissipate and thereby weaken the heart chi. This is typically seen when a person parties too much and is too ecstatic, especially if they consume stimulants and drugs, or there is unbridled hedonism. This constant stimulation of the heart's yang aspect, the shen, will exhaust the heart chi and particularly heart yin. Thank you for listening.
We discuss body fluids, basic concept, formation, distribution, excretion. Body fluids is a general term for all the normal fluids in the body. It includes the various kinds of fluids existing in all the organs and tissues, as well as the normal liquid secretions, including gastric juice, intestinal juice, nasal discharge, saliva, and tears. Like chi and blood, body fluids are one of the basic substances constituting the human body. Chinese medicine distinguishes two general varieties of body fluids, qin and yan. These differ in their characteristics, actions, and distribution. In general, the qin type of fluids is clearer and thinner, moves more freely, and is principally distributed through the superficies, including the skin, the muscles, and the orifices. It also enters the blood vessels readily and has the actions of nourishing and moistening. The yi type of fluids is more viscous and does not move as freely. It permeates the bones and joints, the visceral organs, the brain, and the marrow, where it acts to moisten the structures. Each of these two types of fluids readily transforms into the other. Hence, they are generally referred to together as jinie, that is, body fluids. In clinical context concerning body fluids, it is usually clear which type of fluid, jin or yi or both, is under consideration. Formation of body fluids. Body fluids derive from drink and food through digestion by the stomach, separation of the clear from the turbid by the small intestine, and transformation by the spleen. Thus, the abundance and adequacy of body fluids is closely tied to the physiological actions of these viscera. The distribution of body fluids is accomplished mainly through the joint action of the spleen, transportation and transformation, the lung, dispersion and depuration, the kidney, transformation, and the sanjiao, regulation of waterways. Following transformation by the spleen, fluid is first conveyed upward to the lung, which then distributes it. Part of the fluid is delivered to the body surface to moisten it. Following its further metabolism, the pores secrete the surplus as sweat. Another part is delivered downward, following depuration by the lung, to all the organs and tissues to nourish and moisten them. A portion is conveyed by the sanjiao to the bladder, whereby the transforming action of the kidney, its essential part, is further distributed to the entire body, and the residual part becomes urine to be discharged. Other viscera also affect distribution of body fluids. The liver's conducting and facilitating action enhances distribution of body fluids. The sanjiao acts to keep its flow unimpeded. The large intestine partially absorbs the water from the waste of food and drink for reutilization. In summary, the metabolism of body fluids depends upon the functional coordination and balance of many viscera. Of them, the lung, the spleen, and the kidney play the main roles, and the action of kidney yang provides the motive power for the whole metabolic process. Dysfunction of any of these three organs can lead to disturbance in the metabolism of body fluids and can result in illnesses of stagnation and retention of water. So here is a very interesting flowchart or schema of the body fluids. Thank you very much for your attention.
Let us go to dizziness. The topic is turbid phlegm in the head. The clinical manifestations of turbid phlegm in the head are dizziness, a feeling of heaviness and muzziness or fuzziness of the head, as if it were full of cotton wool, blurred vision, difficulty in thinking and concentrating, especially in the morning, a feeling of oppression of the chest, nausea, poor appetite, and sticky taste. The tongue will be swollen with a sticky coating, and the pulse will be slippery. This condition is due to phlegm obstructing the head so that the clear yang cannot rise to it and turbid qi cannot descend. The aforementioned manifestations are purely those due to phlegm. Obviously, the more chronic condition, the more there will be manifestations of spleen deficiency. This is probably the most common pattern causing chronic dizziness. The treatment principle is to dry the dampness, resolve phlegm, strengthen the spleen, and harmonize the stomach. The points to be used are REN 12, stomach 36, spleen 3, bladder 20, bladder 21, REN 9, spleen 9, stomach 40, stomach 41, LI 4, stomach 8, and DO 20. Using the reinforcing method on REN 12, stomach 36, spleen 3, bladder 20, and bladder 21, and reducing or even method on the others. The explanation for the points are REN 12, stomach 36, spleen 3, bladder 20, and bladder 21 tonify stomach and spleen to resolve phlegm, whereas REN 9, spleen 9, stomach 40, and stomach 41 resolve dampness and phlegm, and LI 4 is used to affect the stomach channels in the face and regulate the ascending of clear yang and descending of turbid qi, while stomach 8 is a local point specific to resolve phlegm from the head, and DO 20 facilitates the rising of clear yang to the head. Thank you so much for your attention.